The topic of my talk is going to be talking about the aneurysms and the newer technology that we have with the Penumbra Smart Coil, and it's how it is changing the game when it comes to treating these acute aneurysms. I have no relevant financial disclosures. So the Penumbra has combined the engineering by using the current 10 system coil, and the result is a smart coil. What are the key features that distinguishes it? One-to-one pusher construction. So the pusher wire is much beefier, allowing the coil to be easily pushed into the aneurysm sac, and thereby not allowing the pusher wire to snake into the microcatheter, this giving you a true one-to-one feel. The Ultra HD stretch-resistant fiber helps to avoid the stretch resistance. So when you're manipulating the coil back and forth inside the aneurysm sac, there's low chances of resistance and stretch to happen. Instant, reliable mechanical detachment. And different coils include this Smart Coil Extra Soft, the conventional helical coil, as well as the wave coil. The Smart Coil is engineered with the complex and the wave shape. And you can see the wave shape is more like essentially no shape. It's described as a liquid metal that is meant to seek spaces inside the aneurysm sac. The other thing I will emphasize on is the Trueform Technology. The aneurysms, when we are coiling, one of the biggest risks we take is the coil loops coming back, thereby causing the catheter to kick back. With the Trueform Technology, when you select a coil, all the corresponding loops are of the same size as the initial loop, thereby allowing the coil to stay inside the sac and not herniating back, especially in the wide neck aneurysm, and I'll emphasize that on some of the cases. And then you can always finish that aneurysm with a wave coil, which essentially find its spaces inside the aneurysm sac. So starting with case one, a 58-year-old with a subarachnoid hemorrhage. It's a small aneurysm, 3 millimeter by 2.9, barely visible. Another view just to look at the wide neck of the aneurysm and the rupture site. Look at, there's an irregularity at the tip of the dome, probably the site where the aneurysm has bled. And this is the complex extra soft 2.5 by 6 centimeter getting into the aneurysm sac. There is no catheter tip movement. The coil is just adhering to the size, its true form, and allowing me to provide a perfect frame for the aneurysm to be filled by the following coils. The picture on the right actually shows you what the frame looked like once the coil was placed. And this is the wave coil following the framing coil. And you can see this is in a subtraction image which shows you how the wave finds its space inside the aneurysm sac. That's the word liquid metal was used to describe this coil. It finds itself all the empty spaces as well as the part of the aneurysm that wasn't initially filled by the complex framing coil. And that allows us to have a perfect aneurysm coiling without any loop herniation into the parent vessel, no more dome opacification or the neck remnant left. We have 3 small coils inside this small aneurysm, allowing us to have good results. The second case, looking at the ruptured PCOM aneurysm, which is 6 by 5. We can see that on this view, the PCA is essentially originating from the neck of the aneurysm. So one of the goals that I wanted to prevent was that the coil loop should not come at the origin of the PCA and thereby avoiding the PCA occlusion. So I chose 5 by 15 centimeter coil, which is just shy of the origin of the PCOM. And that allows me, because of the Trueform technology, that it allows me to have the coil loop sticking to its same size. And as a result, the PCA origin does not have any coil loop herniating over it. And I was able to coil this aneurysm with the PCA staying open and the coil just staying shy of the origin of the PCOM there. Another case, a very small aneurysm. Most of us who deal with the aneurysms know how difficult this kind of an aneurysm is to treat, not only because of the anatomy of how to place the catheter tip inside that small aneurysm sac, but also to make sure the catheter doesn't kick back when you're coiling this aneurysm. So using a very small 2 by 3 centimeter coil, we were able to get a nice frame inside this tiny wide neck aneurysm, and followed by 2 smart, extra soft complex coils, allowing us to have a perfect results that we desired without having any coil loop herniation or any need for stent placement. Looking at a ruptured carotid terminus case, again, it's a very wide neck aneurysm. Difficult to put a stent in because in a ruptured acute aneurysm, I don't like to put stents. Looking at this smart 5 by 10 centimeter coil, again, Trueform technology, allowing the coil to have a perfect shape and staying away from the coil loop herniation. The neck is covered, allowing us to have a perfect frame to be able to fill the extra soft and wave coils inside the aneurysm sac. This is the result, no more aneurysm pacification. Another small aneurysm, 9 by 4.7 millimeter with a patient acute onset of double vision. This aneurysm, I try to use the smaller coils to have better results and optimal neck coverage. We try to start off with the extra soft complex coils, followed by the larger coils to have a stacking effect on the aneurysm, and followed by filling up with the wave extra soft to find those small spaces. The wave allows us to help find all those spaces and fill it precisely. We don't even have to move anything. The wave finds its space inside these aneurysm sacs. And this is our final result. We were able to have a perfect neck coverage without a need for a stent. This is a periophthalmic wide neck aneurysm, 7 by 7 by 5 millimeter with a 3.5 millimeter wide neck. The catheter tip inside, we were able to place 7 by 25 centimeter smart framing coil. And again, the TrueShape technology helps us to get this coil framed inside the aneurysm sac, and it doesn't allow it to herniate back. If you have selected a coil, each loop, corresponding loop, will stay to the same size. Once we have a nice frame, we were able to fill another complex, soft, 4 by 10 centimeter in it. Oh. Can you click on the video here? Not allowing me to show the videos somehow. Anyways, so this is a smart wave extra soft coil, and the coil ends up finding its space right at the neck of the aneurysm. And can you click on the image so that the video can run? No. Well, this image shows you there is still residual filling of the aneurysm sac and the neck of the aneurysm. Can you run this video? There we go. So the wave smart coil, like a liquid metal, finds its way in the neck of the aneurysm in all the empty interstices in the previously framed coil, thereby allowing us to have a perfect neck coverage. And it doesn't allow the catheter tip to herniate because of its softness. And this is the final result. We don't need a stent placement. We were able to get a nice frame with a perfect neck coverage using the wave smart coils in the end, achieving a 27% packing density. This is a small ophthalmic aneurysm, and we all deal with this on a regular basis, where the ophthalmic artery is originating from the neck of the aneurysm. And it's sometimes very hard to keep it open. And again, using the TrueShape technology value, we were able to undersize the coil, thereby keeping the frame of the coil away from the ophthalmic artery origin. And after placing one coil, 3 millimeter by 8 centimeter, we still have some filling left at the bottom, but allowing the ophthalmic artery to fill in its entirety. And then followed by placement of 2 smart coils. One of them is a wave extra soft, leading to the neck coverage, but keeping the ophthalmic artery patent. This is a very wide neck aneurysm, carotid tip aneurysm. Most of us would like to stent this, and I wanted to try the wave as well as the framing coils to see if we can achieve this without use of a stent. It's a 6 by 7 millimeter with a 3.5 millimeter wide neck. With the very first framing coil, I was able to actually get a very nice frame inside the aneurysm sac, followed by 4 by 10 centimeter complex filling coil. And just by using 2 coils, essentially followed by the small, smart, extra soft, and the wave extra soft coils, I essentially had an optimal results where I wanted to see the aneurysm not opacifying at all, and there was no need for any stent placements. Okay. So this is another case, parophthalmic aneurysm, 4 by 4 by 3 millimeter in size. Again, the anatomy makes the catheter placement very difficult. Can you run the video? With the microcatheter tip placement into the aneurysm sac, when the coil is being placed, it can easily kick the aneurysm, the catheter tip back out of the aneurysm. And preventing that catheter tip to come out of the aneurysm, we were able to slowly place the 4 millimeter by 10 centimeter coil. Can you run that video, if possible? No? Okay. So we were able to get a very nice frame, followed by an extra soft complex 2 millimeter by 6 centimeter small coil inside the first frame, leading us to have an optimal results without any need for any significant stent placement. So in summary, what makes me choose Smart Coil for the last 2 years, and I'm finding it very valuable when it comes to treating acute aneurysms, is the Trueform technology that allows me to have very reliable, complex framing of an aneurysm without a need for either a stent placement. It also prevents coil loop herniation. The wave coils are actually pure liquid metal. They will find own empty spaces as you're placing them without getting the microcatheter kicked back. They'll find up wherever the complex has left the interstices empty. The Ultra HD fiber helps to prevent the coil getting stretched, especially when it is being manipulated in and out of an aneurysm or the catheter tip is moving, and the reliability of the detachment as well as the coil. So when I'm pulling the Smart Coil, I'm pretty confident that I'll be able to achieve a good optimal aneurysm coverage and without the needs of a stent placement. I think that's it. Thank you.